Hi, my name is Amanda Jelinek. This is my HENT video, and I am scanning the room. Alright, I would start by checking my patient's chart, making sure I have the right patient, and find out if they are on any medications or need or had any procedures. Next, I would provide privacy by shutting the door or curtain, and then I would wash my hands. Next, I would check my patient's wristband. Hi, Ms. Howard. How are you doing today? Good. How are you? I'm good. I'm Amanda. I'll be assessing you today. Would you like to see your wristband, please? And what is your full name and date of birth?
Lauren Howard, 10/1995.
All right. Thank you so much. And what brings you in today, Ms. Howard?
Just a physical.
Okay. Any medications you're currently on?
No.
Any allergy issues?
No.
No. Any pain?
No.
Okay. We are going to start with the cranial nerves. Cranial nerve number 1 is her smell, sense of smell. Do you have any issues with your sense of smell?
No.
Any changes? No? Okay. Then if we wanted to test that, we could place a cup of coffee or a cup of some garlic powder in front of her and have her guess what they are. Cranial nerve number 2 is her vision. Do you have any issues with your vision at all?
No.
And we can use the Snellen test to check that if there were any issues with it. Cranial nerves number 3, 4, and 6, we are going to check the 6 cardinal phases. If you want to follow my pen, don't move your head. Alright, and those seem to be intact as well. Next, we're going to jump to cranial nerve number 5, testing the TMJ. Can you open your mouth? Alright, there's no clicking, seem normal. And then I'm going to also test your sensation and tell me if it is sharp or dull and where you feel it. You just close your eyes.
Left cheek and sharp. Right cheek sharp. Left side of my forehead dull. Chin dull. Right side of my forehead dull.
Alright, and that seems to be intact as well. Next, we will do cranial nerve number 7. Can you raise your eyebrows? And how about your cheeks? And that seems to be intact as well. Next is cranial nerve number 8. I'm going to whisper in your ear. Tell me what you hear.
Cat. Boo.
Alright, and can you stand up so we can do a Romberg's test and check your balance? Just close your eyes. And my patient seems to be balanced fine, no swaying. Alright, and then it's okay, you can sit down. Cranial nerve 8 looks to be intact. And for cranial nerves number 9 and 10, I'm going to have you open your mouth and say ah. Alright, and patient's uvula and soft palate rose above midline. There were no deviations in her tongue, so those seem to be intact. Cranial nerve number 11, I'm going to push against you. You're going to put your push against me. Alright. You understand? And that seems to be intact as well. You say light, tight dynamite.
Light, dynamite.
And it shows that cranial nerve number 12 is intact. Next, I'm going to check the lymph nodes. Have you had any history of lymph node issues?
No.
No? Okay. We're going to start with the pre-auricular, post-auricular, occipital, tonsillar, submandibular, submental. Then we're going to do the posterior cervical. And can you bend your head this way? And this is the superficial cervical. And the other way. Thank you. And then we're going to move the sternomastoid and check the deep cervical. And you can go like this. And this is the supraclavicular. And none of those felt hard or swollen at all. Next, check your thyroid. Okay, can you turn this way? Check that way. Alright, and any history of thyroid issues? Or was there any tenderness in that issue? Or those times when I touched? No. Okay. And next we are going to check your sinuses. Do you have a history of sinus issues at all? No. Okay. These are the frontal sinuses. Do you feel any pressure?
No.
No. And your maxillary sinuses?
No.
Alright. Next, we're going to assess from the head down. Just looking at your head, I don't see any bruises or cuts or lumps of any sort or any lesions. Her head is normal cephalic. Her facial expressions look symmetric to her face. Her facial features, look symmetric to her face. Any history of trauma to your head or face at all?
No.
No. Any history of hair loss or anything like that?
No.
Okay. Then I'm going to palpate her head. I don't feel any lesions or bumps or bruises or scars. Feel any scars? Was any of that tender? No. Her hair looks. Color is true to ethnicity. It is dispersed evenly. No signs of balding or anything. Her skin looks dry and warm. It's warm to touch from the back of my hand. She has a pink undertone. No scars or bruises or lesions on her face. Do you have a history of acne?
No.
Okay. And next, her skin color was also true to ethnicity. Next, I'm going to start with her ears. I'm going to palpate the tragus and pull on her pinna and push on her mastoid process. And again on the other side. Is this any tenderness?
No.
For you? No? Okay. Any history of hearing problems?
No.
No? If I had an otoscope, I could look in and check her eardrum for being a pearly gray color, but I only have my pen light. So I'm just going to check in for redness and drainage. And I don't see any redness or any foreign objects. There's no drainage or excessive serenum. I'm going to do the same for the other side. And the same, there's no redness, no drainage, no foreign objects, and no serenum. Next, I'm going to start with the eyes. I'm going to do a Perla test. And check the pupils. And her pupils constricted normally. And next I'm going to touch from the side. And doing that, I can see that both pupils constricted at the same simultaneously. Next, I'm going to test her pupil size. It is at a size 4 on her right side, and as well as on the left side. Then I'm going to have you look at an object far away and then focus on my pen. Alright, and her pupils did constrict normally. Her sclera looks white. Her conjunctiva is moist and pink. There's no drainage from her eyes. Do you have any history of drainage or anything?
No.
With your eyes? No? Okay. Next, I'm going to go ahead and do her nose. Okay. Any upper respiratory issues?
No.
No. Any nasal issues?
No.
Okay. I'm going to have you Tilt your head back, and I'm going to look inside. And I do not see any redness or drainage. I'm going to pacitate each side. And again on this side. That looks normal. Her septal is not deviated. Next, I'm going to go on to her mouth. Just looking at her lips, she doesn't have any cracks or bumps or bruises. It is moist, no dryness. If you want to open your mouth. And inside, her mucosa is moist and pink. Her teeth and gums look intact and no swelling, no lesions, no bumps, scars, no bleeding. Do you have any history of like strep throat or any issues like that?
No.
Okay. Next, we're gonna move down to the skin. All of her skin looks true to ethnicity. The color. There's no bruises or signs. She does have a couple tattoos on her wrist and on her arm right here. I'm gonna do a trigger test, and her skin looks elastic and it retracts normally. That shows that she is hydrated. Next, we are gonna jump into some musculoskeletal stuff. So if you wanna grasp my arms. And her strength is shows as a +2 for that, and push against, and then pull me. All right, and all of that shows for a +2. Her strength is normal. Next, I'm gonna do her legs. Can you push your legs up? And can you push against my hands, and the other way, and push against my hands? Okay, and all of that was of normal strength as well. Was that any pain with those?
No.
Okay. Next, we're going to work on some range of motions. Can you rotate your neck? And can you do circumduction with your arm? And can you do abduction, taking your arm away? And adduction, bringing your arm in? And can you stand up and do that with your legs as well? And abduction taken away and abduction in. All right, if you want to sit back up here, then we're going to do some eversion with your foot. Push it out. And some inversion, bringing it in. Okay. And still no pain with that?
No.
No. Okay. Next, I'm going to check some of your joints and make sure you don't have any swelling or any tenderness. Any tenderness with me touching?
No.
Okay, can I get your ankles? Okay. And it doesn't feel like any swelling in those, any tenderness with that?
Mm-mm.
No? Okay. And next, I would make sure that my patient has non-slip socks on, that she has her call light next to her, she's in a low and safe position, the guardrails are up, and her wheels are locked. I would also make sure she was comfortable, and then I would go document all of my assessment. And that is it.